Welcome to Journey Through the Eyes, the EMDR podcast that is here to unveil and explore the transformative power of EMDR therapy. Our mission here at Journey Through the Eyes is to support the new and seasoned clinicians with those critical conversations, the resources for EMDR therapy, and on ways you can build your own private practice. I am one of your hosts. I'm Tamera J. Brown. I am the CEO and founder of Arise Psychotherapy and Coaching Services here in San Antonio, Texas. And I am also a certified EMDR therapist. And I am here with my amazing co host, Miss Kathy on the couch.
Kathy Couch here, Twin Falls, Idaho, and I have Rewired 360, where our goal is to create a university-like setting where therapists can travel through a cohort together. Today we have Lisa Martin, one of our beautiful attendees in our certification and consultation program, as well as Tamera. So we're so happy to have you ladies together. And today we're talking about couples. And so I am Gottman trained, and I know Tamera, I can't remember exactly what your training is, but I know you do work with couples. And today we have our special guest again, Lisa Martin, working with couples as well. And so we just wanted to have a conversation about that, in our relational capacity as therapists, to be able to work with couples and just kind of our experience. So Tamera, do you want to kind of introduce your background working with couples? I know.
Well, I am so excited. Oh my gosh, I'm just so excited. I just got to give honor to this. I'm so excited, so grateful that Lisa is here with us. As I was saying to you, Kathy, before we press the go live button, I just think it's an incredible time for us to be therapists. And we get to bring amazing, incredible therapists like yourself, Lisa, myself, who have been trained in a lot of these evidence-based and just supportive therapy models so that we can help couples to heal, to grow, and thrive. And so I am trained in Gottman Level 1. And I have, and just, I have, you know, working with couples is a juicy but very powerful process, isn't it? And so for me, what I have found is that I have done some work with couples. I didn't realize, right? And I want to hold space for myself and for other clinicians who want to do couples work, but notice that it is so different than individual therapy and it requires more out of the therapist, right? And so for me, what I realized is just how much like how we know that EMDR is a holistic therapy, what I appreciate about the Gottman approach is the fact that it deals with from that perspective, right? From the mind body perspective. However, my go light in in working with couples have been pressed on pause because it requires a lot, right? It requires a lot from us as therapists and requires a little bit more of what I call being present and attentiveness. And I'm still sharpening those skills. So I want to hear where, give Lisa some space and kind of talk about, her expertise and just where she's at with this beautiful space of doing couples therapy work.
Thank you, Tamera.
Yeah.
I'm by no means an expert. I'm a licensed marriage and family therapist. So I come to this. Oops, am I still there?
You're here. We hear you.
You can hear me but can't see me. Now, there we go.
Yep.
Sorry.
Yep. Listeners, while you're doing that, this will be published on YouTube as well. So if you're watching and listening, this will always be posted on YouTube as well. So you can watch the video for us as well.
I'm by no means an expert on couples. I am a licensed marriage and family therapist, so I've seen a lot of couples through the years. I'm not Gottman trained, but I'm getting Gottman trained.
You are.
At the suggestion of Kathy. So I haven't actually started it yet. I think I may have purchased it, but I haven't actually started it yet. So from graduate school, I just did family systems and narrative talk therapy, solution focused therapy, and all that. When I got trained in EMDR a couple of years ago, I was really excited to use, because what I realized is that, you know, trauma is relational. And so why not heal it relationally? So I have, and the very first couple I had was maybe a year and a half ago. And I told them I had never done couples therapy using EMDR. And so there was a lot of psychoeducation and making sure that it was a safe space for both people. There wasn't a lot of interrelational problems in the, you know, in the relationship. There was just past trauma on both sides. And they were finding it impaired their ability to be completely happy with each other, even though they'd known each other since high school and got back together 30 years later. And it's an amazing love story they have. But they had been in traumatic marriages previous. Both of them had. And so I just started doing EMDR with individually, and the partner serves as a supportive witness to the transformation that happens.
I love that supportive witness. Look at you.
Thank you.
I'm sorry, I didn't mean to interrupt you there.
Oh, that's okay.
Yeah, so my journey here has been interesting. I'm not an LMFT. I honor your work, and I think that you've done a lot of training in that area. My background is in social policy and evaluation. I committed in my master's program at the University of Michigan not to work with individuals, and I came back here to Idaho, and I ended up as a CPS worker. And I found myself doing some couples work, being interested in couples, but I never really had a format. And so I got Gottman trained. I can't remember. I'm level 1 and 2 trained. And I tried to do the workshops that they have a format that you can do workshops. And it just didn't go in my area very well. And so what I did is I took Cambria Evans intensive to do the EMDR intensive program. And I used that model and structure to create my own Gottman intensives. And that's the services that I'm providing. I like Gottman because it is structured where we have the assessment and then we do the interventions with couples. From that assessment, we can kind of do a general treatment plan. And they're here for 3 hours at a time in my model. That doesn't have to be your model. You can decide what your model is if you're listening. But what I want to impress upon the listeners is there's different ways to deliver the interventions. And I think what I'm learning is that and Tamera is an abundant thinker as well. And just believing that there is enough. And, therapists in my area or general areas are used to the traditional weekly model. And I just found that if I could do that in an intensive way, that couples could come, heal, get the relationship kit, do the assessment. I meet with them individually, and then we do the intensive, and they're able to kind of resolve some of those 30-year issues, right, in that session without feeling like both couples have to be here at the same, or both partners have to be here at the same time. We have to get to the meet, and then next week something else comes up. And so that's my why. That was my experience, and kind of how I structure that service as well. And I think, Tamera, are you also EFT trained, emotion focused therapy? So I want to hear, could you describe for our listeners that's emotion focused therapy, maybe the differences that you've experienced as a clinician between EFT and Gottman, and kind of what initially you've...
One of the things I will say that with the emotional focus therapy, the thing that I can appreciate about it is that it really helps clients to experience their emotions and learn how to do what Dr. Sue Johnson called a dance with it, right? I will be honest and say that, in my training with emotional focus therapy, just like with EMDR or Gottman, you have to utilize it and practice it and follow the model,
Yes,
right?
yes.
And so it's one thing that I kind of borrow bits and pieces from in my therapy sessions that have helped me to recognize some of the ways, right? Which I'll just use a regular word that we as human beings or the clients we serve just are not comfortable with their emotional experience. We do lots of avoiding it, but moving able to use emotionally focused therapy can really help us to help our clients and ourselves to attune and learn how to be with, right, the emotional experience that often comes up, especially in couples work, right? It's that space of what's going on in between, which is a lot of emotional, things, a lot of stuff that's there between between us and other people, whether it's couples or just we be at work or whatever. But emotionally focused therapy really helps to tune in to the emotional experience and looking at how we are responding or reacting, right, to really our attachment styles, And it to me, in a very short sense, I think emotional focused therapy um, really, really does give a lot of honor and focus to how those early relationships we've had with the big people who took care of us, whether it was our biological parents or another caretaker, how we got wired, you know, how we got wired, just that template, that blueprint of how our nervous system, how our brain got wired. Um, so yeah, so emotionally focused therapy is experiential. It's really powerful, you know. Um, it takes a lot of attunement. I will say that, much like I don't know how you ladies feel about Gottman, but uh, especially just like with EMDR, what I'm learning, oh goodness, is how much presence, how much attunement the therapist needs, and I will dare to say needs to have in order for that healing and that witnessing of the transformation and the healing to really for us to see that take place, right? But a experiential, I mean, emotionally focused therapy really is a very powerful therapy model um, that can really help us, not just the clients, but also help us to tune in and lean in. So I know I probably said a lot, but mhm.
At least I know you and I are doing the treating trauma and affairs
Ooh.
training right now. Have you heard any new information there or?
No, I haven't started that training. I've purchased it, but I haven't started it yet.
Okay.
Got so many in the quay, that I'm doing.
I mean, that's been on my list. I bought it a few years ago and I still haven't done it.
Okay, that makes me feel better.
I
Now,
have a manual though, right?
you
Yeah.
know what? I have the manual too, and I have been, it's on the side of my bed. Well, not for the treating the betrayals. I did the leadership one, the marriage leadership training. Um, yeah, I did that one, which is really wonderful and very powerful, right? It's all in a queue.
Is that on the Gottman as well?
Yes,
Okay.
ma'am.
So I liked it because I could do it on demand. I believe I did it during the pandemic. And what the sound relationship house, do you learn different skills in the different areas? It is attachment based. I do like that they talk about, I'll just kind of give a brief history. So the Gottman Institute began as a research project. And so what they did is they had a love lab in Seattle. And so the couples would come for like a weekend retreat, except for you were hooked up to monitors and people were watching and assessing your every move.
Mm-hmm.
So couples would voluntarily go to this. And so
Mm-hmm.
he did research with these couples and then developed this protocol, not a
Mm-hmm.
protocol, intervention for couples. And it became widely known and it resulted in books. The 7 Principles of Making Marriage Work is a book I use. And so he's done a lot of research with couples, but he also, his wife, Julie Gottman, they do in vivo experiences in the on-demand course, which is fun. So they talk together, they demonstrate the principles, they talk about the nervous system and what diffuse physiological arousal does to the white blood cells in the body. Basically in EMDR land, we call it outside your window of tolerance. Right. And so I think there's a lot of parallels. I think some of the clinicians in EMDR have asked, how do I do EMDR with couples? I haven't quite married those yet. I don't know if I will. My question to you both is, do you feel like there's a part to marry EMDR in a couple session, or are we all kind of keeping it separate? I know for me, it just helps to just be adherent to the different models. I like that. But I'm just curious, maybe for our audience, if they're wanting to blend those areas, what you all think about that.
I know for me, the thing that I love, because EMDR is my jam, right?
I'm with you, girl.
You know what I mean? Because to me, if I can be honest in my own personal view, EMDR to me, this may not be a pretty rainbow picture, but just like how Lisa was sharing earlier and talking about the trauma and all the things that kind of take place within the relationship, if we take a holistic approach as therapists, meaning mind, body, soul approach, right, and looking at the brain and body's role in the work that we do in every single therapy session, to me, that's where EMDR comes in. To me, EMDR is the mechanism that helps us to do what Drano does for the
Oh
plumbing,
my gosh, that's been my theme of the week, Tamara. You've been
right?
talking about the drain, and I've been using that as a resource this week. That's so
Right.
cool.
Okay. So, when couples, for example, when we use all of the beautiful, Gottman tools, or even if you use emotion focused therapy tools and all the things, um, we can get some beautiful work done. However, we know that human beings and life experiences and trauma can be very complex. And sometimes clients and couples get stuck. So, to me, that's where the whole healing. Oh, y'all, my heart is full. Is that EMDR brings to the couples and the people we serve the opportunity for mind and body healing, not just the cognitive or the emotional aspects, but they get the whole three-dimensional healing. Or if we get real juicy, right? It's like you get that whole mind, body, soul, relational connection, energetic, spiritual healing, and you get all of that through EMDR therapy. Okay, that can help us move beyond the stuck points, that can really, if we're going to be brave together. And you know how when we're dealing with clients or we're dealing with couples, and the few couples I have been able to support, some of them were stuck. And a lot of the times they also, because again, we know that doing any kind of therapy takes a level of courage and vulnerability. And that's the thing about us being brave, is recognizing and holding space. It's hard to heal without that vulnerability. We got to be open and willing to experience some tough things. And sometimes the clients that come in, sometimes they're in that pre-contemplation stage of change, where they're not really ready to be open and vulnerable with the therapist or with their partner, and they hide things, right? And so using EMDR, and for couples who are ready to do some deeper work, it also helps create that openness, because we get to do resourcing, right? We get to help them get prepared, to handle and to get more embodied, get more present, and realize that they really got already within the strength and the things that they need to move forward. We just got to kind of unearth it, and EMDR gives us the pathway to do that, in my view.
I'll let Lisa respond there. I have a couple questions on that, but I want to hear from our guest.
No, I agree with you, Tamara. Couples often come to therapy blaming their partners and wanting the therapist to say, yes, you're right. She's wrong or he's wrong about this issue. But EMDR kind of depersonalizes things, and it's kind of a win-win for the criticized partner and the criticizer, because they can both kind of depersonalize it, neutralizes past trauma. So, you know, the client may end up saying, oh, this isn't so much about you. This is me trying to deal with my childhood trauma. And it kind of neutralizes the blame game that we see.
Ooh, I love that. I felt that, Lisa. I love that. And I love that you shared that. That's a lot of wisdom there. And I loved how you use the word it neutralizes.
Mhm.
You know what I mean? It's like instead of putting a band-aid on something, we're able to kind of uh, put some, what is it? You know how when you have a wound and it's throbbing and it's hurting and all the things and you know when they're able to if they got to stitch it, they go in and they put something there to help the pain to stop so that you can do that deeper level work. That's what that brings to mind to me when you said that.
Mhm. Mhm.
Incredible. Yeah.
I have a question here. I've been thinking about. So do you mix those, Lisa or Tamara? Do you mix like an EMDR session? Do you do it with the couple or do you do those individually? Like, hey, you might need some deeper trauma work. Let's set up an individual. One of my ethical dilemmas is I tell my partners, I don't ever want you to feel like there's an alignment between me and one of the partners. So, um, you know, we can do some individual work, but we need to have some pretty clear boundaries.
Right.
And the partner that's not in that individual session, I don't do it often. Um, but I always tell them, listen, you know, uh, if I don't see myself clearly in the relationship with your partner and there's a concern that you have about a disparity in the lack of power, please let us know. But I usually say, really, it's for me, I like to say, I'll refer you to another EMDR clinician, usually to do your work rather than me doing it, unless it's like a really urgent situation for my ethics, because I want both of them to feel like I am equal and not to feel like there's an imbalance of power. I'm just curious how you both experience that issue and your thoughts and your practices there.
You know, well, I would say that I think the Gottman approach gives us a great ethical foundation for that, honestly, when you share that. Because with Gottman, in the early phases when we are serving our clients, we get to hold space for them as individuals, right? With the
Right.
understanding that when those individual sessions happen, both clients are aware and there is no secrets, you know,
Yes.
and having that clause in there. However, I do think we have to, I think that there is a thin line, right? Because if we're serving a couple, then it's the couple and what's going on between them that we're serving. And
Mm,
then we have to be mindful that we will be moving into an individual approach if we try to do some multi purpose counseling sessions, which I would advise in. I would, you know, refer them to another therapist so that way, that duality of mixing it, that just sounds like a therapeutic mix of gumbo in my brain. You know what I mean? But I do think that in the context of when we're serving the couples, right? If there, I think there is a dance we can do with holding space for for them as individuals in the journey, as long as it's serving back to the focus of the couple's therapy, if that makes sense.
yes, I think I think as therapists, we always have to be listening for these things, right? I
Mhm.
think these are all the dilemmas that we always encounter, and so there is room in each case. But I do agree that Gottman set it up correctly. I send out in my paperwork the limited secrets policy, um, and I just let them know, you know, what happens between us is open, um, and there are no secrets. And you have to be really careful, right, with domestic violence. One of the Gottman interventions talk about domestic and relational issues and how do those present, you know, can we treat that in couples therapy? That's one of the major issues. And so just thinking about all of these interventions and thinking about what is the best practice there.
I'm going to ask Lisa a juicy question,
Okay.
right? And because Lisa, like, how
Love
long?
that word, Tamera.
Yeah, you've been doing couples, right? You're a licensed marriage family therapist, right?
Yeah.
What would you say, my dear friend, for the listening audience, and for, just the beautiful folks that may come across this, what would you say is one of the most, if there is one, dominant issues that you see that brings couples to therapy? That's my first layer.
Okay. So I would have to say past trauma in one or both partners. And so I'll use a float back, to an earlier memory when the stakes were higher, when the person was a child and depending on a caregiver for their basic needs, and they didn't have confidence developed yet or resources developed yet, and then use that partner as a resource. And you're right, it is complex. I haven't taken one one member of the couple out to do individual sessions with. I've only done it with the couple there. And so it has to be relationally safe, and both partners have to agree to the work. And there's lots of psychoeducation involved. You're not going to get all that done in one session. But the couple dynamic is the client,
Mhm.
is the main focus. But we can resolve a lot of blocks that other therapies, that individual therapy just doesn't even come close to. When you have a couple together and you're using one of the partners as a resource, it fosters change, connection, understanding, and compassion in a way that individual therapy can't.
That
And that's
is,
what I have found works. That's what I have found that has worked so beautifully. Um, I have I have two couples that I've seen that are now seeing me once a month because they've done their work. They've done the EMDR work and resolved some of that past trauma, and again realized, wow, this really isn't so much about you. It's not you thinking I'm a bad person or I'm a failure or I'm not good enough. This is my past trauma. This is my alcoholic father, you know, and I'm bringing that into this relationship. And for both of them to realize that at the same time is powerful.
you know, my heart, I appreciate you, Lisa, because to be honest, right? And it's going to be interesting to see and hear you all's view on this. And I've said this before to Kathy. I feel like COVID, yeah, it brought a lot of disruption and a lot of pain and a lot of loss. And it totally transformed the way our world operates. But
Totally.
one of the things that it has also done in the same token is that it has opened up the doors of the world to the therapist.
Yes.
Like now we're no longer just confined to our offices that make us in the therapy, and I mean incredible therapies, EMDR, Gottman, emotionally focused therapies, where there's evidence behind the work in the methods. We're able now to bring that front and center and do what we're doing through Journey Through the Eyes and other podcasts, right? Is bringing psychoeducation.
Mhm.
Because to me, families, and I feel really strongly about what I'm saying, human beings will always do, the brain and body, right? Will always do what it has been taught and told to do across time by default. And when you're sharing this, and I know it's bold, and I know it can be eye opening, and I know that it can be stirring, and I know it can be so uncomfortable, but I think we are here to help pour healing and growth to our communities. And when you share that, and you share the beauty, you share the courage, you talk about agreement. How often do you see couples come to you and they're not in a place of agreement or alignment. And then what do you notice is the troubling waters because of that.
Are you asking me, Tamera?
Yes, yes.
I'm not sure I understand the question. Can you
Yeah.
paraphrase?
So, like, you know how when you were saying and you were talking about, when couples come in and they do their work and
Right,
they got to be in agreement,
right,
right?
right.
How they come to this beautiful, some of the benefits of them coming together and healing, and some of the benefits are them coming together and they got to get in alignment, right? They got to make a commitment to doing the work, right? How often would you say when the couples do come in because of the past traumas, are they struggling just in every day coming into alignment in agreement? And then what are some ways that kind of shows up, if that makes sense, right? In their lives.
Well, I think one of the things that EMDR does, and I don't know if this is going to answer your question, Tamara, I hope it does. I think one of the things EMDR does is it takes a toxic cycle when both partners are triggered with each other due to each of their past traumas. It takes this toxic cycle and completely calms down the nervous system in both partners, even the partner who's not currently doing the EMDR, who's not in any particular phase of EMDR, who's just watching and being that supportive witness.
Incredible.
It's been amazing. And like I said, I didn't know what I was doing until I started doing it. I really didn't have an outline for it. I just knew a couple came to me and both had past trauma, and
Hmm.
they felt like it was impairing their ability to be fully happy with each other, and they wanted to really make the most of their lives. They're a amazing love story, like I've said. And so we did EMDR with both of them, each of them being present for the other, and the amount of empathy and understanding and that agreement. Yes, it needs to come first in the psychoeducation part, but it then becomes organic
Hmm.
after they start seeing the work and
Hmm.
realizing what's happening. It becomes organic, that agreement you're talking about.
you know because, and the reason why I asked that question is because as we're here, and whether it's a seasoned clinician, a new clinician, or a possible person who's going through things in their relationship with their partner, hearing how coming and working with a skilled therapist, the benefits, you know, and you answered the question. You notice that, they're not happy and they don't know how, they don't know what. But when they start um, doing the work, you know, um, how therapies like EMDR can help, even if your partner isn't the one experiencing it. And this is something I told one of my clients who is married and had a concern. How is this going to impact? I said, they're just like, COVID is contagious, healing is contagious. And that's just what I hear from you.
Right.
Healing is contagious. And that's the hope I wanted to share by asking that question and saying therapy can be uncomfortable. And yes, we're going places that couples and people typically can't go on their own or have been afraid to visit. But look at the beautiful fruits and the outcomes of what becomes possible, you know. Beautiful, Lisa.
So I have a
Yeah.
couple of thoughts here on this too. A couple of the interventions that I really love from Gottman are being the dream maker and the dream catcher. And so when you come in and you have a conflict and you come in and they have this issue, if a person, I've seen so much healing in that moving to the alignment, and this doesn't apply to affairs, by the way, but if it's just why do you keep piling your shoes by the couch? That's
Mm-hmm.
so annoying. If we can understand why they're doing it, why it's important. I can't tell you how many times just that
Mm-hmm.
problems could be solved, even in my own marriage, if we just sat and were attuned and were present and heard with active listening. And I think if one or the other partners isn't actively listening, they're the four horsemen defending, what is it? Stonewalling, criticizing, those kinds of things. They're not hearing what the partner is saying. And that's, I can't tell you how many interventions the couples that intervention works for. We can understand the why, behind why you buy so many shoes. Well, because when I was little, I never had any shoes and my dad gave them away. Right. And it's like, oh, I have this need to, you know, this, and a partner becomes more empathetic and understanding. And that really has, for me as a therapist, witnessing that transformation, that dream catcher and dream maker intervention can really provide that meaning. And that ties into what we're doing now with David Kessler and the grief work, where we're getting into the 6th stage of grieving, as we are working on that meaning making, with our departed loved ones, figuring out how to make meaning out of that. That's similar and congruent with the couples work, where we're trying to make meaning out of these conflicts. I think that's the basis and the meat
Mhm,
right there.
mhm,
Look at
mhm,
me go. That wasn't
mhm,
planned.
mhm. I love that. And I just love how you shared, because my biggest things, ladies, is giving people hope.
Yes.
And as therapists and wanting to recognize and support both, you know, just our listening audience and then maybe the newer, the seasoned clinician, and saying, we don't have all the answers, but the clients, the answers are in them.
Right.
We're here to guide the journey,
Right.
you know, and relieving ourselves from the burden and also helping our community understand. I love something Lisa was sharing, and Kathy too, and saying that it's a journey and it's a lot about education and educating our clients in order to prepare them for the work that they're going to do, but also helping folks to understand that when we have these beautiful therapy models and we lean into them and we utilize them and we practice them and we begin to understand and facilitate these things, you know, it's incredible. We're talking about taking what looks like, and this reminds me too, y'all. I know we talking about Gottman, but EMDR. I told someone, I said, I don't know. Dr. Francine must have been in a deep glory ring. I don't know where that lady was when she tapped into this, but looking at resourcing
Mhm.
and looking at how the future template of EMDR, but looking at how Gottman also has tapped into this in a very powerful, unique way where you can take what looks like an annoyance and transform it to better the future. Yeah, it is a great day to be a therapist. Okay, when you can take, yeah, I don't know about no, I don't know, maybe I'm just being, but to know and being in writing the authenticity and the transparency boat with Kathy, being married and knowing that in our marriages that we all go through those growth things and have challenges, but in looking at ways how we can get unstuck, because we know that those things, those annoyances, you got a husband or wife that put their toothpaste in the wrong or squeeze from them, and how that can build across
Yeah.
time if it's not dealt with. Small things, small moles became mountains of emotional stuckness and all the things, right? But how there are powerful, powerful interventions and approaches and processes that we can bring to the table to transform these things is just breathtaking to me.
And what happens, one of the things I, encourage people to do is just really that art of, when you're in a relationship with someone, listening and being attuned and being that person that can understand what your partner's experience is. So when we understand their lived experience as a partner, that conflict decreases, the criticism decreases, the defensiveness, the stonewalling, our own reactions, because so many times we're in our own reactions, right? To this event or that event. If we can have that understanding and that compassion, that's a basic intervention that can really transform couples' lives, isn't it?
It is.
And
Yeah.
it transforms the behaviors too that are causing the disruptions.
Yes.
Mm.
Not just our empathy and understanding and being truly present with another human being transforms that other human being too. Not just us, but that other human being. Maybe there won't be as many piles of shoes next to the couch, right?
You know, you said something that I think is powerful, or, you know, and I'm not well versed in narcissism things going on. I'm not well versed in that. But what I do notice when Kathy was talking about stonewalling, right? Before I ask my question, can you share, just for people who may not know, what stonewalling, what it really is? Can you
Of course.
describe or
Yeah,
define
that's
that?
a great question. Yeah. So stonewalling is a part in the body and the psyche where you shut down. And oftentimes in males, it's more pronounced and more apparent, where you see this withdrawal from the relationship. And it's usually coupled with what Gottman calls diffuse physiological arousal, where your heart rate's increasing, your breath rate's increasing, your white blood cell count increases. And so all these things have a component of relational health. And when you stonewall, you withdraw and you refuse to give into the relationship. You refuse to engage with that partner, and you hold all of that. Where do we hold it? We hold it in our body, right? And so stonewall, and those lead to other physical problems. And so one of the things that we know about conflict is that, and this is Gottman teaching me this, is that conflicts end primarily in the way that they're started. So we can predict the outcome of conflicts, how they end, by the way that they begin with gentle startup. So if it's that criticism or stonewalling is the beginning of the conflict, it's likely to end in discord. If we come with an approach of gentleness, like, let me try that again. I didn't like how that went. Can we start over? I was really out of line there. I realized that that's a gentle startup, a small relational repair. And so that's what Gottman calls the antidotes to those four horsemen, to stonewalling, is being able to sort of enter in with a gentle approach and let down those guards. So I just see stonewalling as like your guards up. And then the antidote is just letting that guard down, knowing that you're trusting your person. I did want to say in regards to your comment about narcissism, is that you have narcissistic abuse and antagonistic relationships. Dr. Ramani Darbasula, I just took a training of hers, is where the partner in that, you have to really be aware of that narcissistic relationship when we're working with couples, because if they're in an abusive, antagonistic relationship, we have as a duty as professionals to maintain that relationship. Or do we provide psychoeducation to the client? I was just working with veterans, a person that serves veterans, and he said, we don't want a therapist that, you know, when veterans come in and they say, well, he's angry, he's violent, he's aggressive. If we can understand the underlying pathology, their response was, well, of course he is. And then they had a therapist that said, well, just tell her to leave. And they wanted to make sure I wouldn't do that. And I said, well, first we have to treat the trauma that is
Right.
they're experiencing, right? And then we can work on the relationship. A little bit different than a narcissistic relationship. So really that assessment in both partners is so critical to determine, can this relationship, what's my role in maintaining the relationship health, or making that person, you know, stay or leave? I know that was a long answer, but
Yeah, no, I think that that is important. And I think this is a great place to consider a a conversation on narcissism and understanding it. And the reason why I say that is because, you know, I don't want to assume, but you know, when you go on social media
Oh my Lord.
and there's so many people, right, who are Dr. Googling, diagnosing their partner,
Yes.
whether it's male or female, as having narcissistic, it's concerning to me And one thing that I said, because I want to hold space and recognize some of the behaviors and the experiences that a person who really has narcissistic personality disorder or appropriate diagnosis for that, right? Knowing that their behaviors in relationships with them can be hurtful, devastating, and traumatic.
Yes.
Okay. While also acknowledging for the person who has the diagnosis that they didn't choose to be that way. No different than a person who's been giving a medical diagnosis with a very challenging health condition and how it can deteriorate the body or the mind or whatever it is. Okay. And I just want to hold space. I think that is so important, especially now, to be able to provide information and insight so that people can turn to the professionals and also stop, pause, calling someone something, labeling people, and you haven't had, and I'm sorry, you can go to coaching, get a book. Self-help books are not evidence-based clinical books that can help you actually determine if the person is really
Yes.
got a narcissistic personality. And some
But
of the
boy,
things
that
you
word's
described.
being thrown around.
Come on, say it again, Lisa.
That
Yeah.
word is being thrown around on social media. I mean, on Facebook, I see it everywhere. I see it everywhere. I have clients come in and tell me they're in a narcissistic, abusive relationship. And I ask them what they mean by that, and they're not sure. They're really not sure what that means. They just know they're feeling traumatized by the relationship, but they're not sure what that means. And I feel I haven't done enough to educate myself about what narcissism actually is and what it isn't, so that I can help my patients understand what it is and what it isn't. It
I
just
recommend this book here. It's by Romani Darvasula. It's Not You, Identifying Healing from Narcissistic People. Let me take my background off here. And I just took a PESI training on that. And it's really important. She's doing research into this and making the pathology more apparent to people so that we can have accurate diagnostic criteria to be able to figure out who we're treating. And so she has a lot of really good scales and measures and ways that we can work on this. And so I think that's really, she's trying to advance that area so it is more in the clinical world understood, and we're all on the same page with what it is. I think that is one of the research limitations, right? Is that we don't necessarily have that. So I think she's bringing that forward. And her focus is more on healing people from narcissistic and antagonistic abuse, and also what's the treatment for the others.
Mm-hmm.
Who is that? Who is the author of that book again, Kathy?
It's you gotta write it here. Ramani Durvasula.
Thank you so much.
Mm-hmm.
She's been, you know what I did is I saw her on a lot of the crime shows and analyzing different pathology, because one of the proposals is that not all what is that? I'm gonna say it wrong. Not all sociopaths are narcissists, but all sociopaths are narcissists, something to that effect. And so I think we gotta kind of really dive in and really understand that pathology behind this. So it's different for our listeners or maybe people that aren't clinicians. This is a personality disorder. It's not a mood disorder that can be treated with medication. So that's why we're talking about these behavioral interventions. It's a disorder of thought and behavior versus something that can be treated with mood. It has mood characteristics, but you're not going to get an SSRI or antidepressant for this. And so our clinical interventions are intended to mitigate the distress that their personality produces in others. And that's why it can be sort of abstract.
Mm-hmm. I just think that this is really powerful. I think, being able to help and support couples, um, and talking about just some of the challenges couples can often face, and then looking at therapy models like Gottman approach, you know, uh, EMDR, right? And then really addressing and highlighting some of these challenges couples are facing and looking and painting a picture on a way of healing paths to help them to move forward. And I so appreciate Lisa in talking about, ways couples often coming in. They just, it's the blame, right? Because as human beings, we need to hold somebody at fault. Somebody is responsible, and it's not me, right?
And it's not me.
And so this has been an incredible conversation, and just want to hold space for Lisa, and then Kathy, you will guide our audience on where they can find us and all the things. But Lisa, just want to hear just any last words you have about couples therapy and all the beautiful, incredible things we've heard today.
So I am so pleased to have been here, Tamera. I'm really a big fan of yours, and Kathy knows I'm a big fan of hers as well. EMDR can resolve blocks from the past. And I think my experience has been that relational issues are often based in past trauma and don't have anything to do with what's currently going on. And regular couples therapy is very present focused. So when we delve into past traumas, and again, we don't, with EMDR, the magnificent thing about EMDR is you don't have to rehash your whole gory childhood. We can come up with a target memory. When was the last time you felt that way? When was the last time you felt criticized? What was the earliest time you felt criticized? And they start having this deeper understanding, deeper meaning, and then we take it down into the body and do the body scan, and they get relief almost immediately from doing that kind of work, whereas 6 months of talk therapy isn't going to get you that same place. I mean, talk therapy has its value. I'm not at all denigrating that. But I've just, for me, EMDR has been transformative for couples I've worked with and for me personally.
Beautiful. I love it. Thank you, Lisa.
Well, thank you for everyone for being here today, for your time. Thank you to our listening audience. You can find Tamera at Arise Therapist. You can find me at Rewired 360, and we're getting Lisa a website. So you can find us here. We're so happy to have our audience here. Please write us with your questions, journeypodcast360@gmail.com. We love to hear from you if you're interested in being on our podcast. Message us. We love to have new innovative speakers. Next time, we're going to have a Kajabi expert on here so that we can learn about the platform and how therapists can work in Kajabi and what services it has. So I'm so excited for that, and I hope our listeners can tune in. So we're in season 2 now. So we're so excited to launch season 2. Thank you to all our listeners for being here for season 1. Take care.
Take care.